Good morning. We are really glad to talk about some updates on our work relative to COVID-19 testing. Just note that, we don't call these meetings pooled testing meetings because we've always had more than just pooled testing, and we will continue to look for, pooled testing and other approaches as we begin next school year. So as we begin today's session, I just want to remind you kind of who's involved in this initiative on an ongoing basis. Lauren and me from DESE, our close colleagues from the Shaw Foundation, and really appreciate the work that they've done to support districts. If you haven't been in touch with Shaw and you have questions or concerns about implementing pooled testing, please be in touch with them. They are so glad to provide support, problem solving, answer questions. So don't hesitate to reach out. And also, this is such a close collaboration. I'm the spokesperson, the spokesmodel for our work that you get in these meetings, using an old pop culture reference. But the people who are really the brains behind the operation are everyone you see on this slide, and particularly our colleagues in the COVID Command Center at the Executive Office of Health and Human Services, Jeremiah, Sean, and Amar. So it's really a collective effort. And again, we're all here to support you and answer your questions as we go along. For today's presentation, like I said earlier before we started the recording, Jenna Ferguson from DPH is going to talk a little bit more about vaccine clinics. Really pleased to have colleagues here from the Safer Teachers, Safer Students Collaborative to talk about their initiative and how districts can get more involved in it. So we'll be introducing Alham in just a minute. And then really a big focus for today is thinking about next year. How do we think about COVID testing for next school year? And then finally, some updates on using at-home Binex Now tests, as well as FEMA reimbursement for a more limited number of districts. I'll explain more about that when we get to it. And as always, we'll review any of those key next steps and focus on time for Q&A at the very end. So a lot to get through in an hour. Let's go ahead and move forward. So first topic, thinking about vaccine clinics in schools. So pleased to be joined today by Jenna Ferguson, the Assistant Commissioner from the Massachusetts Department of Public Health. Jenna, I'll be glad to advance the slides, and thank you so much for being here with us today.
Well, thank you very much for having me. I really appreciate it. I know that there have been a lot of efforts among the school districts in the past couple of months related to employer clinics in particular, or getting staff and of the school systems vaccinated, but wanted to talk about a newer initiative, an expansion of initiative now that we have approval for Pfizer vaccine to be used in students 12 and up, and also the possibility on the horizon of other vaccine formulations that might be available, including, you might have seen some stuff in the news about the possibility of Moderna applying for also FDA use. But right now we know we have a vaccine that's available for children over the age of 12 or 12 and up. And so we really are trying to do some hyper-local outreach to try to enable and encourage our families and any remaining staff and employees who may need vaccination. So I want to talk about school vaccination clinic options particularly, but I want to talk about it in a context of both schools for clinics for students, as well as remaining staff, and thinking about this as employers of those staff. So, we have had clinics set aside days at mass vaccination sites for staff of K-12 establishments. We also have a number of regional collaborative locations across the Commonwealth. And of course, as you all know, a lot of vaccine opportunities within the pharmacies. But we're looking at, as the Commonwealth, some ways to try to bring the vaccination clinic to people as an alternative, or to really set aside time. So there are a couple of options that really were set up for employers, but have now been expanded to include school students. So I want to talk about them a little bit. You may have heard about these from the employee standpoint, but I want you to know that just really, as of last week, this is now launched for students. So really thinking about these as school vaccination clinics. These are students students' families, and staff of the school. So option one, it's the quickest and easiest. The idea of this is we have vaccination sites that are available. We can group appointments together to kind of do like a school day or a school time. I've got this listed as employer/schools because, again, you can think about this both for staff as well as for students. We can work with you to request a block of appointments at any of the mass vaccination sites, keeping in mind that some of those group locations may be starting to wind down some first dose operations, so they're not all necessarily available. But that's one of the things we can do in order to kind of personalize a little bit. You can set up a table, so there's an on-site presence. And really looking at that case for a minimum of 10 appointments to reserve that block of time. There's no maximum limit, but we'd want to know that we could set aside 10 appointments for you to have that kind of like clinic day at that particular vaccination site. Because for Pfizer, we're looking at 2 doses, 3 weeks apart. We'd be doing the first dose clinic as well as the follow-up second dose clinic with you in the exact same way, where it's like, the date that people can come. So that's one of the alternatives. If you can go ahead and go to the next slide, Russell. The second idea, clinic opportunity is really to bring the clinic to you. Russell, you started out this presentation with a picture of photographs of people being vaccinated, a school-based clinic on site. You could see everybody there. You had the tent, the kids. It was really a local vaccination effort. We can do that on request for schools with a confirmed number of 35 or more employees, students, family members. So it can be a mix. It doesn't have to be 35 employees or 35 students. It can be a mix to obtain a vaccine at a pop-up clinic. So the idea is, if the school can identify and confirm those 35 individuals, we'll bring the clinic to you. We'll set up a day, we'll come on site, and the vaccinating provider will vaccinate the individuals there, and then again, return later to do second doses. We just want to make sure that actually have participants so that so it's worth the time to send out the mobile provider, but really are having some success so far. This has just launched. 25 schools so far have requested an on-site clinic for students. The site that's on our mass.gov, I have spelled out kind of the overall URL, but this is, even though it says employer vaccination program, if you go to that page and you click on the form to do a request, it says on that form that is both for employers and for schools. So really do want to encourage people to think about whether or not you can bring a school vaccination clinic to you. We can do this during the school year. The mobile provider is already on contract. We're already doing the work. So it really is a relatively quick process to get you scheduled. So, really promoting this both for school, could be during the school day, could be on the weekends, school students, as well as, again, employers or staff, excuse me. So, we've been talking about this a little bit. I want to set this up for you here, but I'm happy to, answer questions people might have, but also follow-up questions that someone might have after this presentation today. We can, certainly do these clinics. So, I don't know your process for you're doing questions, Russell, but I will, there are a couple of questions that I received privately. I'm happy to talk about them, but, or we can, I can defer to you on how you do the questions. But, really in terms of timing, we probably will transition away from these first dose clinics at some point because most people are getting vaccinated. You may have read in the paper, over 50% of eligible individuals have been vaccinated in Massachusetts. We're getting up to 70% of eligible adults have received a first dose. So, which is just fantastic progress for the Commonwealth. So probably won't, wait to be seen as to whether or not we need booster doses at some point and all of that. But right now we're talking about clinics this year, not necessarily next year. And I think we're really looking for the ability to reach people now is that they're eligible. And then one of the questions I received is whether or not this is through the summer. I don't have an exact end date, but right now we're just launching it as of last week. And so there's a possibility that these could continue for some time. But, I encourage people to engage in this, especially if you're trying to reach students since the school population is in session.
That's really helpful, Jen. And I think I would just encourage people that form is very simple, very easy to fill out. I forwarded it on to a school leader just recently myself, took a look at it. And so I think when in doubt, fill out the form, make the request. And it really seems like DPH wants to work with you to, customize this, make it an experience that works well for you and your community. So Jen, I appreciate the way that you embedded that question right into your presentation right now. If you wouldn't mind, to stay around till the end, and we'll have Q&A at the end and see if there's any other questions that come to you that you want to share out, or that people can certainly funnel questions to me, because I'll go ahead and facilitate the Q&A session at the end.
But absolutely happy to do that.
Thanks. Sounds great. Really appreciate it. So we really kind of organized this presentation today in terms of just the timing that we're in. And so vaccines are happening right here, right now, as well as work that STSS has been doing. Again, the Safer Teachers, Safer Students Collaborative. I'm really pleased today to have Alham Sadat with us, who's a wet lab scientist at the Broad Institute. And really her work there, just so that you kind of know who our guest speaker is today, really focuses on connecting GWAS-associated genetic risk variants for metabolic diseases and traits to function. In addition to her role as a researcher, Alham works to identify ways that Broad scientists can carry out equitable biomedical research that helps reduce existing health disparities. So, so pleased to, I think one of the strengths of our model in Massachusetts is we have the science community behind us and informing us and guiding us. And I think that's really been what STSS has helped to do, to bring together just so many great minds from our science community, as well as our districts and parents. And so really pleased, I want to turn it over to you. I'll be glad to advance the slides so that people can find out more about STSS and their opportunity to contribute to the work that STSS is doing.
Great, thank you, Russell, and thanks for everyone here on the call today. I hope to provide a little background on how Safer Teachers and Safer Students, STSS collaborative came to be. Some of the efforts we have led are ongoing currently, and where we think our efforts can be focused as we transition into the fall. So STSS formed as districts across the country grappled with how to open schools safely. The work of STSS began in the late summer of 2020 in Wellesley, and soon thereafter, volunteers from many other districts joined the effort. The goals were simple: prevent outbreaks, maximize in-person learning, reduce fear and anxiety, and measure if mitigation protocols were working. Next slide, please. As the group worked to identify how to best address outbreak prevention, maximize in-person learning, reduce fear and anxiety, and measure whether mitigations were working, we realized that testing would be critical. As such, we set out to the following goals for some pilot testing programs that we tried to establish across a few different schools. And the goals for these pilot programs were relatively straightforward. Ensure equitable access to PCR-based screening that had a relatively quick turnaround time, demonstrate proof of concept for surveillance infrastructure to replace fear with data, and create a general framework that could be rolled out broadly across many communities. Next slide, please. As the group continued to evolve and grow, we established the following core principles. We wanted to have as wide of access to testing as possible, ideally universal, regardless of race, ethnicity, geography, or status. Decision-making on the transition states between schooling models would be driven by data on cases and transmission. 3, testing in public school settings should be available at cost, so to limit the economic barriers, and that we would focus on identifying best technologies and approaches for this testing to make this possible for public schools. And then we also worked to and focused on developing a general framework for best practices. We thought that was urgent and also really critical for making sure that all schools had equitable access to understanding how to implement this in an effective and thoughtful way. Next slide, please. As the months went on, the SDSS kind of grew to over 30 districts. Were made up of scientists, educators, administrators, nurses. There's important vendor representatives, policymakers, economists, funding sources. And we tried to create a free trade zone for transparent sharing of experiences and data as it relates to testing in public school settings. Next slide, please. A few local outcomes worth highlighting. This number has changed since these slides were made, but there's been over 100,000 tests run so far, with 100 plus cases removed from schools in Massachusetts. Early detection of outbreaks, which was one of the key goals for the group, has been effective. And selected building specific openings and closures in response to real-time risk monitoring have been enabled due to the testing programs. And kind of one of the central things that we've identified as one of the main drivers and important goals for the group was just we have seen a dramatic reduction of fear and anxiety, and have actually measured this across a few districts via surveys, which we think enables schools to open both safely and without families fearing and teachers and administrators fearing for kind of outcomes related to infectious disease issues. Next slide, please. In addition to some of the data that I shared previously, one other part of the SDSS group has focused on creating a data dashboard. So this dashboard provides district level data granularity across a variety of data points. So we were able to capture positivity rates on a district specific level, as well as participation rates for the testing programs at the various districts that are currently participating in our survey. This is a huge thanks to Andrew Tang and Ben Cooley for all of the design efforts that went into this. And we think of the dashboard as a forum for districts to compare and contrast testing processes and outcomes across districts. It was fantastic to see that the reduction of distancing from 6 to 3 feet showed no major uptick in testing positivity across districts. And the data from the dashboard informed feedback from SDSS districts to DESE as well. And as with all data, the more the better. Please join this summer in filling out the survey and adding your districts to become a part of the dashboard. We anticipate this will be important going into the fall as well. Next slide, please. One other area that the SDSS group has also focused on, these efforts were led by Andrea Ciaranello, whose efforts are working to collate a comprehensive implementation analysis. So here, the efforts are hoping to describe the breadth of screening models, as well as document resources required for implementing screening, both financial and human-based resources, and then estimate all-in costs of screening. So here, kind of questions around the interplay between vaccine uptake, new variants, and decisions about masking and distancing in schools. And these will become more critical as we kind of transition into the fall. And questions that would be relevant is, do we screen it at all going forward into the fall? or do we screen all populations going forward into the fall? Do we screen some subset of the school community below a certain threshold? Do we set a threshold for community cases per 100,000 as we've done previously? And she's collating this information into a paper, which we hope to publish soon. Next slide, please. And kind of following up on the theme of fall 2021, it will be uncertain, testing goals will be nuanced, and we think surveillance testing data may add some clarity. There will be a lot of different points to consider. Some of the bullets here are highlighted. So variants versus vaccines versus flu related illnesses, testing of all students versus specific populations, each group kind of performing each district performing their cost benefit analysis, and surveying parents and teachers could be helpful if you have an engaged population to assess some of these metrics as well. And the good news is preliminary reports suggest that even at low participation rates, surveillance testing is incredibly useful. So even with low participation, districts should not be discouraged from opting in. And one other thing that we think would be interesting and important to consider going into the fall would be to consider engaging school-age children in science classes and learning about why these mitigation strategies would be important, and set them as set class challenges or things similar to that to increase participation at each school. And then that we could add this and layer this information into the dashboard as well. And if anyone is interested in getting involved with this dashboard, we would love to have you join our efforts. You can reach out to us here. The link is posted below here. The K-12 testingcollaborative.org. During the summer, we hope to be updating the interface to maximize its usefulness. And we hope to add local vaccination rates into the types of data that we're sharing out. And we'd love to hear from the community what else you would like to see in the dashboard. So please reach out to us. And I'll finish here by saying that the efforts from this STSS are, they span many, many districts and involve many, many people, a few of them highlighted here. With that, I will end my discussion. Thanks again for listening.
Yeah, absolutely. This was really helpful. And what I appreciate about what STSS has done is they brought such an independent lens to this work and such a scientific lens that is so helpful. And I know that there have been a lot of questions from our districts about participation rates. Before we go on, I wonder if you can just say a little bit more about, you referenced, some studying of that, maybe some research on that. Could you just say a little bit more about your perspective in particular around participation rates, and what it means to just continue to increase it, that low numbers are not necessarily the end of the world?
Right. I think, it's a multi-layered, participation rates are a multi-layered issue. And each district is kind of grappling with their own reasons for why their rates are maybe slightly lower than they would like. But the one thing that is reassuring is that and Rosie here, if you could jump in on the actual citation, there is some data that suggests that even with low participation rates, the data that you get is useful in making decisions around various things such as limiting exposure to other members in your school community, and to understanding whether mitigations that are currently in place are effective. So even with small, kind of lower, below 70 or 60% participation rates, there you can still, or right in that range, you can still extract useful information that can help guide thoughtful decision-making for districts.
And yes, thank you, Alham. There is a nice recent paper that we can certainly share with Russell and his team to circulate to everyone on this webinar to read more about the value of testing, even in a situation where there's no participation. Basically, any case that you pull out of the community and perform the mitigation measures around it solves a potential outbreak. So other outbreaks may happen, but you catch them with the symptomatic testing. But anyone you pull out with an asymptomatic case only helps kind of, keep a lid on the COVID infections in a community. So it really is, even with 20% of your population taking part, it's awesome. It's really great. So you should feel happy about the fact that you're running it. Obviously, the more the merrier. And we at STSS have had a lot of conversations around what is it that changes behavior. We had a fantastic conversation with a behavioral economist a few weeks ago who said, number one, reduce friction. So if your district is finding that there's a particular element of your pooled testing that is driving everybody crazy, the summer is a time to figure out, do we need to switch vendor? Do we need to switch our process? Do we need to switch something else about the way that we do this to make it easier in the first place? If reflex testing is a problem, it's not, most districts are finding it's pretty okay, but there's a few that have mentioned the reflex testing is tough. Switch to a vendor that doesn't require you to do reflex. They do all of the in-lab deconvolution, so you just find out the exact individual from the pool when the results are reported. That could help. And the other thing that Elham already mentioned is that kids are an amazing driver of change. This is an incredible learning opportunity for them. And there's nothing like gamifying a challenge to get schools competing with one another to have the best participation rate, or to have districts competing. And if there's a way that you could imagine the dashboard itself being a place where we have a leaderboard of who's increased participation the most, not necessarily the highest participation full stop, but who's doing the best job of increasing it, we'd be happy to talk to any of you with ideas of how to make this fun.
That's excellent. Thank you, Rosie, and thank you, Elham, and thank you to the whole STSS team for the great work. And I think it's just important, my big takeaway for everyone on this in this meeting today, take a look at the website. I know that I'll put the link in the chat, so take a look, and I would encourage you to do so immediately. Just gives you that sense of another resource, another collaborator that's out there working with us, and I just look forward to our continued collaboration. So thank you both for being here today. All right, so a few things about as we look forward, and a lot of this will sort of build on what we just heard as we think about next school year. So let's just start with the summer though. So for this upcoming summer, our current contract with our vendors does definitely allow us to provide pool testing in certain school scenarios. So if you're wondering about continuing pool testing this summer, we have two scenarios to share with you that will definitely work for maintaining these services. The first is a summer school program run by a participating school or district. And so if you are running your own summer school program, if it's run by the district, even if it's some different people who are involved, the district running the program helps to qualify for continuing to participate. We just know, though, that there are a lot of different camps and programs that exist all across our state, and a lot of partnerships between school districts and other providers of summer services. And so we also created, a category of school-affiliated recreational programs, knowing that there are programs that take place in your schools. They are often, again, that partnership between the district and a group like the YMCA or the Boys and Girls Club. The one key requirement is that you have to have at least one employee of the program who's working with the program who's an employee of the school district, because our contract is very much based on school personnel being involved, school personnel providing assurances, attesting to complying with the quality of the services that we want to provide. And so if you have any questions about whether or not your summer program qualifies, please just email us at the address that you see there, the K-12 COVID-19 testing at mass.gov, and we will be glad to answer your questions and hopefully just keep as many services going this summer as possible. Another change that we've made in the here and now is about private schools. And so I'm hoping that we have either private schools involved in this webinar right now or listening to the recording. And so as effective immediately, all private schools in the state are also eligible to participate in our pooled testing program through the end of the summer. That's what we've said for all of our programs, keeping in mind that we need to redo contracting for next year. And so that will allow us to extend the same offer that we've made for public schools to private schools. And we're just really pleased that the federal funding that we have to create more testing opportunities in the state can be extended to private schools too. So welcome to our private schools. We're glad to have you. We're glad to start getting you matched up and add you to the list of schools and districts that are participating. So just want to briefly talk about any new organizations like our private schools that might be joining, or anyone who's listening right now and still wants to participate. Again, we're glad to have you join at any point. The one thing that you have to do is to apply to be an authorized school and submit a statement of assurances. We have that all done through a survey. Many of you are familiar with it, but it's just, those are the 2 steps that you need to take. And again, any information that you need is on our pooled testing webpage. And we've gone over the eligibility already, but if you have any questions, just read this slide in a little more detail. It should cover what you need and have the links that you need to get started if you are just joining us in our pooled testing initiative.
Russell, I'm sorry, can I just add one quick thing there?
Of course.
Thank you. So just to be clear, if you are testing now and you want to continue testing into your summer school, you don't have to do anything. Just please tell your vendors so that they can make sure your services aren't interrupted. But Russell said it right. So if you're going to start something new, whether that's like a new camp, or if you are a private school or a school that has not started yet, then please do fill out the application. Thanks.
Yeah, absolutely. And I just want to point out what Jeremiah said is right here on this slide. So when you go back over the slides later, you'll have the information that you need. It's just about talking to your vendor about keeping the services going, nothing more that you need to do. Thanks for that reminder, Jeremiah. Really appreciate it. So as we envision next year, and this really builds on what we heard from Alham, is that, we're definitely thinking about the need for what we're calling comprehensive in-school testing programs for next September. So keep in mind, just like I said, our current contract for our current services expires at the end of August. So we're going to need to go back out and look for, maintaining the current level of service and thinking about how we can expand it to perhaps be even more comprehensive for next year. And again, building on what we heard from SDSS, we're just very mindful of some things that make us think that despite the great improvements that we have with the vaccine being available, there's still going to be the need for using a role for testing in schools next year. In particular, when I think about it, we didn't really have a cold and flu season this year. We had, many fewer students in school, a lot more physical distancing. We'll have more students in school next year, likely less physical distancing. And so the greater likelihood of a cold and flu season is there. And so figuring out what's COVID versus what's flu or cold will be a challenge for us next year. And so testing, I think, will definitely help us with that to maintain as much in-person learning as possible. And then, we know that we're going to start this school year with our youngest students not being vaccinated because it's just not available yet. And so we know that, we might need to differentiate or think about, where we need surveillance testing the most, but we definitely think about those unvaccinated students. And then we just know that, the regular ongoing testing provides protection that, could decrease the necessity for other safety measures. We know that those changes are coming. But testing can help us just have the information that we need in order to assess how we're doing with those changes in mitigation strategies. And then again, we just want to catch potential outbreaks and promote safety for our students, our staff, and our community as a whole. So I think, it's been important for me to begin to kind of visualize what's going to be different about next year than this year, even though, we're so pleased and proud to have so many students in our schools. Right now, it's actually going to be even more next year when we have, so many of our students who are learning remotely back in person. And, we just feel like let's start to prepare for that now and to think about it more now. I know you all are. Just so you know, the HHS team and Lauren and me, we are getting out and visiting schools right now. We went to Lowell this week, and we're talking to people about what do you teachers, nurses, administrators, how are you thinking about next year? What do we need to know about your thoughts? And we're getting really great feedback, and we look forward to keeping our little road tour going to get more ideas that we will continue to use as we build our thinking for next year. So, we are very hopeful, very cognizant of the need for us to continue to fund pooled testing and diagnostic testing. So when I talk about a more comprehensive model, what we are very much thinking about is continuing on with pooled testing, but also looking for opportunities to bring in diagnostic testing as much as possible. More to come on that. But again, if we have to differentiate between what's COVID and what's not, that's where diagnostic testing could come in. So just want to begin to, again, paint a picture for a way in which our services could evolve for next year as well, kind of maintain what is good, what's working now, and maybe evolve into diagnostic testing. And we're going to cover the same types of things that we have done right now. You'll notice on this slide that we talk about some close contacts, some additional testing available for some close contacts. I'm going to talk about that more starting on the very next slide. And then we're just very cognizant, and it's part of what we're doing on our road tour across the state, is to hear about the challenges, the concerns in implementation. And so it's really helping us to think about how do we build in more supports to our contracts for next year so that we can take as much work off the shoulders of schools as possible so that you can focus on that number one job that you have of providing an excellent education to the students you have the privilege to serve. So we look forward to following up with you on our plans for next year. But I just want you to know that, key takeaway from today is we do intend to provide services free of charge to you for next year. And we're hoping to maintain what is working well in the way of pooled testing and Binex Now, and then expand perhaps to diagnostic testing where available. And we look forward to following up with you more on that. I mentioned that we are going to talk about the use of Abbott Binex Now for close contacts. This is a great advancement that we've been able to bring to you, and excited to share with you a little bit more about it. We have recently made available what is called the eMed at-home Binex Now test. So this is a lot like the current Binex Now test. It's a rapid antigen test. It's the exact same test. The test is the same. It's what goes around it that's different. So, using the test in the school, having that swab, having the card reader, all the same. What's different is in that second bullet is that there is a virtual proctor. So if you're using the eMed at home Binex Now, the kit includes a way to log in, have a virtual proctor watch you on screen, do the swabbing, have the card, read the results, show the results, make sure there's confirmation between you and the virtual proctor about those results. This is optional, it's not required. So if you're saying like, whoa, Russell, that sounds like a lot, you don't have to do this. If you're saying, hey, this could actually be useful, I'd like to provide this service, then we definitely want you to take advantage of it. And we really think that, you might be asking yourself why. Well, we think that that ability to have access to testing earlier on could remove any barriers to getting kids back into school as early as possible. So we know that to come back to school on that 8th day after exposure with, a negative test is to have access to that test. And so we think that just providing families with the test is going to be a very easy way to make sure that they get the information they need. Hopefully the results are positive, and we want to see that student back in school as early as possible. So a little bit more detail about this. We have updated our website so that particularly our Abbott Binex Now page that's within our overall website, so that you can get the information that you need. You just submit a form to request this particular Binex Now test. It's not the same Binex Now test. So if you have that stockpile of Binex Now tests in your school, you're not just going to start sending those home. You would request the eMed Abbott Binex Now test so that you get that virtual proctor built in, and those are the tests that you would be sending home. A really important detail about this is that when you make the request, we're going to send you enough based on what you tell us so that you can send 2 tests home. The idea here is that the student is able, or the staff member can take that test immediately upon arrival at home. Once they begin their quarantine, just to see if they are positive, then that starts the quarantining period. Lets them know that, the countdown is on until when they can come back. But more importantly, it really helps with understanding who else needs to be identified as a close contact. How, having that information right away can very much help to reduce the spread in our schools. It's just another way of reducing the spread in our schools. So one of the tests can be used right away. And then the other one is used after that, 5 days after exposure. It's actually on day 5, 6, or 7. I realize that's a little weedy. We can follow up with you on it. But keep in mind that that person has to have a negative test to return to school on day 8. And so those 2 tests, one immediately, one for use on day 5, 6, or 7, if negative, can get this student back in school, the staff member back in school on day 8. And so all schools are eligible. And the beauty of this is there's no need for a CLIA waiver, reporting, training, PPE, or a doctor's order. So some of you who are listening who've struggled, particularly with doctor's orders, particularly our private schools with this, there is no need for the doctor's order, and because you're administering the test at home. Jeremiah, Lauren, you've been closer in on this than me. So what other details would you like to add here?
Sure, I can add in. I just want to double down on the fact that you have to place a new order for the eMed at-home Binex Now test. You cannot use the Binex Now test that you currently have in your school for this purpose. So there are a few questions that are coming in from the chat asking if they can use the supply that they already have, and the answer is no. You have to get the specific eMed at-home Binex Now test, which will be mailed to you by DPH after you submit a new resource request form. And so the information about how to use the, how to order the tests, and then the information for families, which has been translated into Spanish, is found on our website, which is by, I put it in the chat a couple times.
Great, thanks, Lauren. And such an important clarification about the difference between the eMed Binex Now and the traditional Binex Now that they're using in schools, that it's administered by a professional. So there's that difference that's important. Great. All right, so let's move on to our last topic for today, which is about FEMA reimbursement. So our combined group between HHS and DESE have worked together to apply to FEMA, the Federal Emergency Management Agency, to get reimbursement for costs that districts have incurred for testing to date. Now, here's the thing. Most of you don't have costs because you've been involved in our program, in the statewide program. There are some districts, though, that are participating, they're providing pooled testing on their own. They're paying for it on their own. They are not part of our statewide initiative. They might be working with different vendors. And so this is very important for those districts in particular, because we have been able to receive approval for those districts to apply for reimbursement for their costs through FEMA. I think this is very good news. So, if you, again, our second bullet here, if you're involved in our program, there's no action that's needed. But if you've done pool testing through a program outside of DESE, outside of our program, you can apply to FEMA. And it's important to note that not all reimbursements are guaranteed, but it's definitely a process that we've laid the groundwork for that should provide a lot of, I hope, a lot of needed reimbursement across the state. And so we do expect there to be more information forthcoming from MEMA, the Massachusetts Emergency Management Agency. But in the here and now, you can immediately begin to send any questions about this reimbursement model to the email address that you see on your screen. I know Lauren sent the slides many times during this presentation, so feel free to grab that email address if this offer applies to you, and definitely feel free to follow up. Lauren, anything to add on that one?
No, there are some questions coming into the chat about the specific costs, the specific reimbursements that they can request. And so our recommendation would be to email that disaster recovery email address to find out all of the various types of reimbursement that they could request. Everything from staffing to the supplies to the vendor contracts, I think is all up for discussion. And so we recommend contacting that email address directly.
Yep, and I think it's those are very obvious costs, and should really be the first place to go to ask for reimbursement. So definitely, and we'll keep you posted as we learn more as well. This is sort of later breaking news in terms of this school year, and good news. So thank you to everyone who helped to get this in place so that we provide as much support as possible for our testing initiatives everywhere in the state. So finally, just a couple of review items in terms of next steps. Like Jenna presented at the beginning of the meeting, thinking about the COVID-19 employer vaccination program to get that vaccination clinic on site, and other strategies for providing vaccine services that she mentioned at the beginning of the presentation. We ask that you consider providing SDSS with information about updated pool testing. DESE has continued to produce weekly updates statewide, but as you can see, SDSS is getting a little more granular at the community level with voluntary information that you provide. So consider sharing that information with SDSS. And then, if there are any plans that you need to confirm with us, or feel free to reach out to us. But like Jeremiah said, the group that you mainly need to confirm your summer plans with is your vendor. So really, you can bring questions to us, but it's mainly your vendor that you just need to talk about in terms of continuing those services through the summer. And then finally, just like we just mentioned, there's a unique and separate process for requesting the at-home Abbott Binex Now test, the eMed Abbott Binex Now test. And so just use that form to get what you need. I know you've got a lot on your minds as we close out the school year, so we thought that this quick summary at the end hopefully just brings that clarity of any next steps that you need to take. But why don't we move to the Q&A right now? I'll just open my chat to see if there's anything there for me. And Lauren, Jeremiah, I hate to tell you, people have not really sent me so many slides, so many questions. I did get one at the beginning about the percentage of schools participating and the number of schools participating. I don't have our dashboard right at my fingertips. Sean, I don't know if you do, or Jeremiah, but the number of schools participating most recently, it's been over 1,000. I'm sure it will go up now that the private schools are joining us too, which we're so happy about. But do you want to just report the number real quick, if you have it?
Mr. Sean, I can jump in. As of, I think this morning, actually, it's about 176 districts are participating, and that is about 1,000 schools are actively testing. So quite a big number. Yeah,
great. Thank you, Sean. Thanks for having that at your fingertips. Lauren, any questions that have come into you?
Yep. So actually, we're going to jump back to the presentation about the vaccination clinics. And so, Jana, this one is for you. Who is responsible to keep the vaccine documentation if the clinic is at school?
So the way that works is the vaccinating provider keeps all of the data for the people who are vaccinated, all the demographic information, records of what kind of vaccine they received, et cetera. And that is actually reported to the Department of Public Health through an immunization system where we collect electronic health records. Those electronic health records can be accessed by the local health department, by physicians, et cetera. So it's a great place to store this information, and it's actually mandated that happen. Certainly the school can keep records of that, but most of these required data and the reporting will be done by the vaccinating provider and by the department.
Great. Jumping to the eMed, and Jeremiah, if you want to answer this. So who notifies the schools of the results of the at-home eMed Binex Now? Is it the proctor or the parent?
It's the family. So the family has to notify you that they had their negative test, and the same way that they would if they went out and got a PCR test on their own, or they went out and bought a test over the counter at CVS. If they wanted to come back after day 7, they need to inform you of the negative test.
But Jeremiah, the system actually notifies DPH, right?
Correct. So the family just has to tell you, the school, and that's how they get approval to come back. But Russell, you're absolutely right that they're reporting to the Department of Public Health and all the other steps that have to happen through the vendor there.
And Russell, if you could actually go back to that eMed slide, there's a lot of questions about the 2 tests and when those need to be taken. And so Jeremiah, do you want to walk through that?
Yeah, so the idea was we could just send one to make sure that they take it on either day 5 or 6 or 7, and then they can come back on day 8 for the existing protocol. We're just making it easier. And that's where we started. And then we realized, actually, you know, it's a benefit if we have these tests at schools anyway. It's a benefit for people to be able to test themselves immediately because they've had an exposure. It's a good way for them to get comfortable with the test so that by the time they take it the second time to return, they're familiar with the process. They've created their account. And so that's number 1 and 2 is they can take number 1 right when they get home, just make sure that they're not positive right then. And then number 2 is really to take that one to return test on day 5, 6, or 7 for return on day 8.
Great. And lots of questions about which close contacts can take this test.
The close contacts that are being sent home per DISI's protocol and close contacts.
Great. So not to be used for any identified close contact, because now we've differentiated between less than 3 feet and then 3 to 6 feet. And so only those that need to go home to quarantine should be taking this test. Great. Questions of, can you use eMed if you're not participating in pool testing, or do you have to be part of pool testing to do this?
You do not have to be part of pool testing. We want all schools to be able to do this.
Great. Just looking through. There's some questions, Russell, a lot about for the FEMA reimbursement, if staff, if they can request reimbursement for the staff that they have hired to do pool testing, either in-district staff or outside consultants or third parties.
And Lauren,
Hi, Addison. Good job.
Whoops.
So my understanding is that if you should ask, right? I mean, this is, there's not sort of a one solution answer to what will be reimbursed through FEMA. I think it will be a requesting process. But if you have costs that are legitimately and uniquely for pool testing, not a staff member who you had doing something else, or but if you really did hire somebody just to do this work, we think that would be something that you should submit for reimbursement for. But Lauren, Jeremiah, you've also been close to this. Would you add anything further to that?
The only thing I'd reemphasize is that it's not a guarantee. I think for any district that's done this, it's well worth the time to fill out the application. But I just want to be clear, this is like FEMA's decision, and this is out of our hands.
So Jeremiah, another for you about the eMed, just wondering how the consent works. Yeah,
so one of the nice things about this is that when the account is created, so you have to create the account because then you get matched with your proctor. That's the point at which the family provides consent. So you don't have to manage consent. It's all with the vendor. When the family enters the demographic information, which is then what would get reported to the Department of Public Health. When they're creating their account, they provide consent right there. So you don't have to keep track of it. You don't have to get it. They do it themselves.
Right. And lots of questions about the notification that the family will receive. Once they sign up for an account and go through the process, they will receive the notification in writing of what the test result was. So that notification could, in theory, be forwarded to the school as evidence of what their test result was. Questions about funding for next year. And so lots of questions about how likely is it that we will be able to provide the funding for any type of testing next year, and will that funding last throughout the year?
So, we are the beneficiaries of a grant from the federal government. It went to the Executive Office of Health and Human Services, and so it's administered by the team that Jeremiah and Sean represent in Amar. And obviously we're doing all of this in very close collaboration, but the amount is $207 million, Jeremiah, unless I'm off by a little bit there. And that's the money that we're applying for both the end of this school year, this summer, and next school year. We think it's a very healthy amount of funding. It's impossible to predict, like, will it be exactly enough? Will it be a little too, how will we stretch those dollars? But we're very mindful of coming up with, again, thinking about, just like we did now, what's the best value? How can we create both effective and efficient testing system for the state so that we can make sure that we just use those dollars effectively and responsibly? And so there'll be more on that as we go ahead, as we go into our next round of contracting. But our eye is on using those funds well to cover as many of the costs next year as possible. Jeremiah, anything you'd want to add on that?
No, I think that's exactly right. And I think folks are right to probably draw a line between the fall and the spring, and maybe they end up looking exactly the same. But to your point, Russell, like it's a quick changing world out there.
Yep, in terms of what will be necessary even in the winter.
Correct. Sorry.
Exactly. Great.
Can I
Yeah,
jump
Janet,
in
please.
and
Please.
go back to a previous the topic about the negative test results from the eMed Binex? So this is something that comes up on our local health calls. I have regular calls with our local health departments, and as everybody on this call probably knows, it's actually the local board of health that decides about quarantine requirements and officially releases someone from quarantine or from isolation. And so that written notification that one might get might also be something appropriate to provide to the health department. So not just the school, but also to the health department. So that good communication with your local public health agency will be really important around managing this kind of really new technology. So I know that public local health has had some questions about these at-home tests. And so, you know, as we all transition to these new technologies and the types of testing that becomes available, that communication will be really helpful, I think, in case there are any questions. So that's a really good way of also keeping the health department informed.
Jen, I'd like to think that a lot of those communication structures are built. And I think it's always like a reminder just to say, keep using them. Like now that you get this result that looks different, it comes through a different channel, just keep that communication going with your local board of health, send those results over, make sure that communication continues to move ahead. So, so I hope that we can just build on a foundation of collaboration.
Yes, thank you so much.
So just one last question, I think, Russell, that we have time for is just about the languages for the Proctor and the eMed at-home mobile site. And so, yes, that is, the Proctors will come in multiple languages. And so a family can request a language that works best for them. And we have translated the notice that schools can send home with families into Spanish, and we will be translating it into our other top 5 languages, and it will be posted to our family communications site on Google.
Hi, are you here?
Okay.
Can I just jump in and ask a quick question? I sent it in a chat to a couple people, but I'm not sure if it was seen. For the tests that are done, if we have a mobile clinic come to our school site, are the parents required to be there to vaccinate the students, or can they just come with the consent that is on the mass.gov site and then fill out the screening tool as well? So we just wanted to clarify that.
Sure, Jenna.
So we'll require written consent, but not necessarily that the parent be present.
Great. So the student could come in without written consent, and then just the vaccine can happen, be delivered right on site. That shot can happen right there. So I hope that helps.
Great. Thank you very much.
And just reiterating, we don't require ID. We don't require proof of insurance. This is, you know, all we can do to reduce the number of barriers to get somebody vaccinated. So it's really any guardian. So it's not necessarily the parent as well. Obviously, we would accept any kind of legal consent for a minor.
I'm sorry, where is the consent for the vaccine found?
We have it online, and I can send that link to Lauren, and if and then Laura can distribute it if you don't already have it handy, Lauren.
We can follow up with more information, and we've been putting information in the Commissioner's Weekly Update on Mondays for the past several weeks, and so we'll just keep that going. That might be the best way for us to push out any more information as well, just so everybody has it. So so we'll follow up on that as well. I know we're at time. I just want to say thank you to everyone. Thank you for working with us this year on all these different testing initiatives that we brought forward. I hope you have a great restorative summer. We'll be back with you, I'm sure, at some point. Kind of, you know, our goal is to make sure that you have a sense going into August, so as early in August as possible. I don't have an exact date yet, but we've set a goal for ourselves to be back in communication with you in August to talk about next year, the vendors who we're working with, how to get involved, how to stay with where you are, how to change if necessary. But we look forward to just bringing you more information. And until then, again, take good care of yourselves, take good care of the students who we have the privilege to serve. And I look forward to seeing you again soon. Take good care, everyone.